So Objective 4 was about providing nationally consistent SCI rehabilitation services and extending into community-based rehabilitation. And essentially this was a very big one. There was lots and lots of feedback and lots of different ideas from people about what was working and what wasn't working. In the report, we've highlighted survey findings where a range between 35% of people feel they can access specialist pain management services. So there's clearly 65% of people who are feeling that they're not accessing specialist pain management services when they need to. Access to psychological support is also a little bit lower, and access support to manage pain is lower. Some of the others, people are feeling like their rehabilitation needs are generally well coordinated, and that there's timely access to health and rehab support, and there's access to reassessment. This is variable between people. People have very different experiences. That's just the survey responses. Essentially, data from the spinal units suggests that there's ongoing changes are being made to the way that reassessment and outreach services are being provided, just from a sustainability perspective. So they are trying to work on that, but we feel there's some more work that could be done in that area, and particularly looking at innovative ways that better meet the needs of people with spinal cord injury and their families, rather than just is this a sustainable service option. The New Zealand Spinal Cord Injury Registry is aiming to do community follow-up question survey, which will gather data about how people are managing once they're discharged from hospital, so 18 months, 5 years and 10 years. And this data is going to provide some really helpful information in the future to explore people's secondary health complications, how they're utilising healthcare services, what their pain management services have been like, and also return to work outcomes, etc. So that data that's going to be coming out of the registry will be really helpful in the long term. In terms of things that people talked about within the interviews, particularly, but it also came through in the surveys, actions to reduce the impact of funding differences on equity of outcomes urgently required. And particularly this navigation through a variety of services and getting access to services when you need them is a particular issue for people with on Ministry of Health funding. Often they are available, they're just not aware that they can access them and how to access them. So it's as much about navigation and knowledge as it is about whether the services are available or not. Specific, timely, accessible and personally meaningful provision of information for people with spinal cord injury remains an issue. So information is, people feel they haven't been told a lot of information, and people providing information feel that they provide a lot of information and people aren't taking it in. So it's an interesting conundrum, because clearly information is really important, and yet the information that people need isn't being received. And so our recommendation is that we really look at how information is provided to people, how it's given, when it's given, and whether it's given at the right time for when the person needs to know it and understand it, and not just assuming that because someone was told it when they were an inpatient, means that they've understood it and can use it when they go home. Changes to reassessment and outreach services I've kind of alluded to, but essentially there's timeliness and modes of delivery we feel need to be looked at. And overall, we felt that the current systems, or someone described that the current systems are not seeing me as a person, and they're not as invested in the outcome as I am. And that's consistent with previous reports, and certainly interview data suggests that the expert opinion of healthcare professionals is often prioritised over people's own experiences of what will work for me in my situation. And that was a theme that came through. So our two key recommendations were about increasing the transparency of systems and processes so that people know where they're going, what the expected pathway is. That means that they can then advocate for themselves if they need something different, but also navigational support for those that need it to navigate their way through services and access the support they need when they need it. And second main thing related to pain services, review of pain services across the continuum, including within the unit. So that people leave the spinal unit having a clear pain management plan in place, and that there can be these closer collaborations between the various providers and supporters and carers and family who are journeying with the person with spinal cord injury as they try and understand how to manage their pain over the longer term.